Hi, I'm Kaycee Peterman. I'm the Prevention Coordinator at the Alcohol and Other Drug Resource Center. I'm going to refer to it as AOD from this point forward. I've created a Prezi to help explain the services that we offer here at the AOD for you as RAs. So if you want to look at Okay, so like I said, this is the Alcohol and Other Drug Resource Center. We're located in Seal Hall. Seal's a little bit of a funky building because the upper levels don't connect. So to come up to our office, you need to come on the east side, either the elevator or the stairs, the side that's closest to the road. And our main office is in room 208. We're open Monday through Friday, 8 a.m. to 4:30 p.m. And our phone number is the 309-298-2457. We're a department of Butte Health Center, so any of the clinical services that you would receive at our facility will go into your medical record. This is important for you to know as RAs because if you refer someone to our office for a step 1, we cannot inform you of any of the services unless if that student signs a release for you specifically. It's also for students in general. If you come to our office to receive clinical services, we can't let student judicial or your professor or anyone else on campus know about the services unless if we have a signed release. Another piece that's kind of unique about our office is we're licensed by DASA, which allows us to provide DUI services. So kind of getting into our mission, I'll read this pretty much directly off the slide. AOD's mission is to prevent the development and progression of the addiction process in WAU students. This will be accomplished by providing substance abuse prevention education and intervention services, such as assessments, referral, treatment, and recovery support services. So in summary, we are here to prevent the development and progression of addiction by doing prevention education and intervention services. That's the two types of services we offer, and I'm going to explain the differences of those in these next few slides. So intervention services. As RAs, you may be referring students here for a step 1. To give you a little bit of information about that, that's a one-time appointment. It's an hour long. We do a little bit of an assessment and we provide a lot of education. We can also get referrals from student judicial for this type of appointment as well. Another service that we have is a comprehensive evaluation. This is a 2-hour-long assessment where we're gathering history, current symptoms, a lot of information about the individual, and we determine a diagnosis and what kind of service recommendations there are. We can have referrals for this type of appointment from student judicial, the courts, or the individual themselves. And as RAs, it's important for you to know about our initial assessments too. If you have someone on your floor who you're concerned about their alcohol usage or drug usage and you see how it's impacting their life, and it's been impacting it in a negative way, and they have not been mandated to come to our office, you can encourage them to come to our office for an initial assessment. This is kind of like a crisis triage type of appointment where we'll meet with them and see, recommend, further services if they need it. It's a free appointment, so that way we can, there's less of a barrier for students to come into our office for that. We also have self-referrals for this type of appointment as well. So from these 3 types of appointments, we can recommend early intervention or level 1 treatment. To briefly explain the difference, early intervention means a person doesn't have a diagnosis and they just need a little bit more education, and treatment is a person has a diagnosis and they're actually needing treatment services. And the last part of our intervention services are those DUI services. We can do DUI evaluations, DUI risk education classes, and Secretary of State investigative reports for people who've had DUIs or have lost their license and they're trying to get them back. So another piece, on the flip side, that we have the prevention services. This is going to be important for RAs because we do those different types of programs and events throughout the year. You can see here like some of our specific events and programs that our office does is like Root Beer Olympics, safe tailgating. We also collaborate with other departments. So One of those that we've done is Club Wetzel. We've collaborated with housing with that pretty much every year. We also do Midnight Mardi Gras with the Rec Center. These are just some of the collaborations that we do here on campus. There are many more, and if you as RAs come up with any additional programs or events that you want to do, you can always invite us to come to provide some education, some alcohol and other drug education. And at the very bottom, we also give presentations in classrooms, at sorority and fraternity meetings, and in the residence halls. So this next slide shows us the list of presentations that we offer. This is just some of the presentations. We actually have additional ones, but I couldn't fit them all on this slide. So, and I use the word presentation kind of loosely here, because like at the bottom, the Alcohol Jeopardy, it's a board where we do this a lot on the residence halls. We have our categories on the board, and we break down the students into teams, and they answer questions as a team, and it's interactive, fun, and it's still educational at the same time. So we ask that you give us a 2-week notice if you want us to come and do a presentation or be part of an event that you're planning. My email is there at the bottom, so you can always send me an email if you have any questions or have an idea and want to kind of bounce some ideas back and forth off of me. But like I said, we do ask for like a 2-week notice, and we can customize anything to fit the needs of your students. So kind of in summary, we offer the prevention services as well as the intervention services. On the prevention side of things, if there's a program or presentation or event that you want us to be a part of, you can always email me or call our office to ask about that. On the intervention side, if you're coming for like a comp eval or a step 1, we ask that you either come to our office or give us a phone call, because email is not confidential, so we cannot set up those appointments through email. And this slide just shows you some of the pictures of some of the events that we've been a part of, and just some of our pieces that we use, like our ginormous BAC squad wheel and our, our ginormous BAC wheel and our bag set that we have that we take around to different programs and events. So again, our office is in Seal Hall, room 208. That's our phone number, and if you have any questions or about any of our services, please give us a call. Thank you very much.